per DL or higher than that. Like generally in nowadays, we would say 130 by 90 is normal because knowing the current lifestyle, knowing the the stress levels that we all face lately, knowing all of that, we understand that 130 by 90 is something which is considered as normal. The doctors won't really start with medication, but originally 140 by 90 mg per DL or mg HG or higher than that is considered as hypertension or high blood pressure or BP ka problem hai, is what normally we would say. Right. What are the symptoms of hypertension? So something like a severe headache, nausea. Nausea is basically a feeling of vomiting, not exactly that you would vomit out, but a feeling of vomiting, dizziness, blurred vision, anxiety or confusion, irregular heart rhythm. Generally, these are the similar symptoms that you face when you have a little low sugars or even extremely high sugars. So the correlation here is that it both are inflammatory diseases. They both cause you, both are inflammatory conditions. The complications are again the same here. It is rhinopathy, nephrology, cardiovascular diseases, nephropathy. All of these symptoms are both for hypertension and diabetes. People with diabetes are more likely to be diagnosed with high blood pressure, yes, because of the eating habits. Of course, both of them are lifestyle disorders as well. So next time when you face any of these symptoms without getting checked by a doctor, do not go ahead and treat yourself assuming that it is because of high blood pressure or assuming it is because of low diabetes. Right, like all of these have similar, both of them have similar symptoms, similar complications, and the risk factors are also interlinked. Right. Now, how often do you check your blood pressure? How often do you want to check your blood pressure? Right. When you have blood pressure issues, when you have hypertension, it is mandatory to check your blood pressure on a regular basis, on a daily basis. Okay. Likewise, when you have diabetes, it is mandatory to check your blood sugar levels on a daily basis because they are different every day. Likewise, the blood pressure is different every day. I'll tell you the normal category of blood pressure here is less than 120 of systolic or the upper number. If it is less than 120, then it is considered as a normal blood pressure. And if your diastolic is low or the lower number is less than 80 is considered as normal, 80 or less than 80. Okay. Now, elevated means it is a slightly higher, 120 to 129, the upper number, but the lower number is still less than 80. It is considered as elevated. We do not term that as high blood pressure or hypertension. Now comes the hypertension stage, where your upper number or the systolic blood pressure comes to 130 to 139. Okay, or your lower number or the diastolic is between 80 to 90. We term this as stage 1 of high blood pressure or hypertension. Right. Now, high blood pressure stage 2, which is 140 or higher, which is the upper number, systolic, and diastolic, which means it is 90 or lower than or higher than 90, is termed as hypertension stage 2. Right. Now, in these two conditions, you can manage it by proper lifestyle modifications and also a basic drug which your doctor, which your cardiologist would recommend. The immediate action or the moment you have to run to the doctor is when you have hypertensive crisis, when your systolic, which is the upper number, is higher than 180 and your lower number, which is diastolic, is higher than 120. That is the time when you actually have to rush to the hospital immediately, get an immediate treatment by the doctor. Okay. Nowadays, we have a lot of ways where you can actually check your blood sugar levels. We have manual monitors, we have manual manometers, we have the electric ones. Now, when you measure your blood pressure, there are certain things which you have to be very careful while monitoring the blood pressure. I have seen a lot of patients who actually would just lie down and monitor the blood pressure, or who would just randomly give any of their hand to monitor the blood pressure. But if you actually want to know what exactly your blood pressure is, these are the instructions which you have to follow. Okay, to make sure that you're getting the right values, okay, for your medical condition. Firstly, make sure you validate your monitor, validate your sphygmomanometer, be it electric or manual, and ask your healthcare provider or your pharmacist to actually get it to check it, to see whether it is well calibrated, to see whether it is correct or not. That is the first ever step, right? The second thing is before 30 minutes before you check your blood pressure, you have to make sure that you've not smoked, you've not had any alcohol, you've not had any caffeinated beverages or tannin beverages, which is a tea or coffee, and you've not done any kind of exercise. Okay, 5 minutes before your blood pressure is taken, you have to make sure that you sit on a chair and relax. This is the before precautions that you have to take. Now, while your blood pressure is being taken, you have to make sure that you relax, you don't talk, which is not very possible right now because I've actually seen a lot of patients, and even I check the blood pressures of any of the patients, or if I go to a clinic, I actually see them talking to the doctor while they are checking their blood pressure. Don't do that. That also is going to increase your heart rate. That also is going to increase your blood pressure. It's hardly a 1 minute job where you don't really have to think too much. Just sit, relax, rest your cuff arm comfortably on a flat surface like a table, and it has to be at a heart level, like how you can see here, right? And you have to sit upright, your back straight and supported. Make sure your feet are flat on the ground and not crossed, or you've not kept your one leg over the other. This also leads to wrong reading because that will lead to elevated blood sugar levels. Okay, right before that, while checking the blood sugar, make sure the cuff is on the right side, is of the right size. It is not too tight, it is not too loose, or else you will get the wrong value. Wrap it just above your elbow, where your elbow bends, just above where your elbow bends. This is what we call as brachial artery. You have to make sure that it is right above where the elbow bends. Wrap it against your skin, not over the clothing. If you're wearing something whose sleeves are still there, make sure you're rolling it up, or you wear something which is a sleeveless, and make sure you roll it on your skin and not, and there should be no material in between the cuff and your skin. Okay. If at home, after that, after checking your blood pressure, make sure you wait for a minute, take a second reading, and take an average of the readings. If you feel it is coming very different, take a third reading also. Consider the third reading also. We need the best of readings. We have this human nature. जो reading correct आएगा, जो reading low आएगा, जो reading normal में आएगा, हम उसको लेंगे. That's not the case. But make sure you take 3 readings and take the best of one. Okay. Now, the best recommendation here is if you have blood pressure issues, if you have hypertension, if you are on any medication or any kind of treatment for blood pressure, make sure you're maintaining a diary for yourself where you write down everything. You write down what is your blood pressure at that time, at a specific time, whatever time you're taking, or whatever the doctors recommend you to take. Make sure you write down whatever you eaten in that journal, so you also come to know how is the food reacting with your blood sugar levels and how is it actually correlated. The kind of activities that you do during after which you feel that your sugars are going to be your blood pressure is going to be increased or your blood pressure is going to be decreased. So you have to make sure that you manage or you maintain a journal and carry that with you every time you visit your doctor. Only then the doctor is going to be able to do something about the medication or recommend any further things. Okay, now comes to how you can, lower your blood pressure. There are a lot of things you must have heard. People say that do not eat salt at all. Make sure you work out intensively. Make sure you lose a lot of weight. Go opt for a low sodium salt, etc. Few things are actually true, where you have to make sure that your diet is high on fiber and protein. Fiber, which means that you are having good amounts of vegetables in your diet, be it cooked or raw, depending on what suits your gut. Make sure you speak to your nutritionist or your health coach or a healthcare provider to know exactly what suits you. Make sure your diet is rich in protein, which means your legumes, your pulses, sprouts. If you're non-vegetarian, definitely opt for eggs, your chicken. Also, make sure that you use the correct amount of salt. Cut down on sodium does not mean you have to make zero. Make sure you're having it in a limited quantity. As far as possible, avoid raw salt. How much ever it is utilized for cooking, use that much and avoid raw salt. Right. Other thing is opt for low to moderate exercises. Do not go and over exercise when you know that you have high blood pressure issues. Of course, that is going to take your blood pressure from between till to sky high levels. Make sure you uptake a lot of potassium, be it in the in food form or be it in supplement form, whatever your doctor is recommended. Reduce your intake of caffeine and tannin, which means your tea and your coffee. These two have to be reduced. In fact, what you can choose over these is maybe you can go ahead and choose infused water. You can go ahead and choose, smoothies, all of this, so that you have better fiber in there. Plus, you're hydrating yourself very well. And get a good quality sleep for approximately 7 to 8 hours of sleep in a day is mandatory. If the sleep is at a stretch, that is brilliant. But if you feel that you don't get the correct time to sleep, a lot of time to sleep, make sure at 6 hours is at a stretch and 1 to 2 hours you can manage here and there. Right? Cut down on alcohol and smoking. That is one of the most important things. If you are a smoker, if you can make it zero, very well, brilliant. If you cannot, cut down on the quantity, cut down on the sticks that you smoke in the entire day. Make sure your alcohol intake is not more than once in 15 days into a very limited quantity. Maintain a healthy weight. This doesn't mean that you have to get on a crash diet and reduce or shed excess weight here. But maintain a healthy weight. Like I said, speak to your nutritionist, speak to your healthcare provider so that you can maintain the correct weight. Okay, we have certain FAQs here. Shilpa, are you going to read out the FAQs?
Yes, I think Bhakti, we have all the slides also the slides also do contain the FAQ, so you can maybe click on the question so everyone is aware of what the question is.
Okay. So the first question here, these are the questions that we've been asked very commonly by by our users also, and commonly any kind of healthcare providers get these questions very often. What are the best practices of managing missed medication or treatment interruption doses? We get this a lot, that I forgot to take the medication, or my medication dose is over. So what do I do with that? In this case, make sure you restart your medication. There is a reason why a medication is being prescribed to you. So it is mandatory to restart that medication and then again keep your your blood pressure levels checked very well. And then you can visit your healthcare provider. At least for a week, make sure you, after the medication is started, you're checking your blood pressure on a regular basis. Right? That's the first question. The second question, what we frequently get is, what quantity and frequency of alcohol intake is considered unhealthy? Okay, so blood pressure starts to rise as alcohol consumption exceeds more than two standard drinks a day. For us, standard drink is 30 ml. Just to let you know, because sometimes what happens is standard drinks for most of them is 6. Let's get a standard right here. So a 30 ml, 2 drinks, it starts rising after 2 drinks. Because women have lower levels of an important enzyme that metabolizes alcohol and on average are smaller than men. Many recommendations suggest that women not exceed more than 1 drink per day. So maybe 2 drinks for men and 1 for female, and make sure this doesn't happen on a regular basis. It means not on an everyday basis. Another question, is it true that lack of sleep can cause high blood pressure? Absolutely. Sleep helps your body to control hormones. Now, if your hormones are controlled, automatically your stress is being controlled, your metabolism is being controlled. Hormone changes due to sleep deprivation that can lead to high blood pressure and other risk factors like heart disease. So the better you sleep, the better your muscles are relaxed, the better your hormones are relaxed, the better you will be able to manage your blood pressure. Can seasonal changes cause changes in blood pressure? So blood pressure is generally higher, both the systolic and diastolic in the winters and lower in the summer because you shed a lot of, a lot of water during, you end up drinking a lot of water during your summer. So you're managing your electrolytes also very well during the summer. So your blood pressure is managed very well at that time. And at low temperatures, your blood vessels are temporarily narrow. So that is one reason the blood pressure in the low temperature is higher. What type of diet should I follow if I have blood pressure? So, like I already said, the kind of diet that you can follow is make sure that you're having good amount of. So I generally recommend 4 steps, when you have to follow a proper diet for a healthy lifestyle or to manage your blood sugar level, blood pressure level. First is, of course, you have to make sure that you're having good amount of fibers in the diet, which means select good vegetables, be it raw, be it cooked, be it in the soup form, you can just blend it and smoothie it. That is also fine. Make sure you're having good amount of fiber. Second, make sure you are eating at equal intervals. So every 3 hours, small frequent meals at every 3 hours so that your body keeps on getting constant energy and you don't feel low at any point in time. Third, what you can do is make sure you're hydrated very well. That you're having good amount of water in the entire day. Can be in the form of buttermilk, can be in the form of lemon water, can be in the form of plain water, infused waters. All of these consumption is also going to make sure that your blood pressure is maintained very well. And last but not the least, exercise. Do not, do not take your blood pressure for granted, saying that okay, you have high blood pressure, so you will not exercise at all. So make sure you find a little bit of your time to, go for a walk or just do a little breathing exercises. Make sure you eat foods that are high on calcium, magnesium, potassium, and eat less foods which are high on sodium. Like I said, try and avoid, raw salt is what we can say. Whatever is used for cooking, it's always good.
Thank you so much, Bhakti. It was a wonderful presentation. I think we have a couple of questions in the chat, so I'll just quickly take them up. So one question is, how do you improve the consumption of potassium? What can we do to increase our potassium consumption?
So we can include potassium. Am I audible?
Yes, you are audible.
Okay. So we can include, potassium-rich foods, like you can have avocados, you can have kiwis, green leafy vegetables, beans. All of these are rich in potassium, which you can include in your diet. Like I said, green leafy vegetables are very good in potassium. So instead of making it into a sabzi, which I don't think a lot of them would consume in a big quantity, what you can do is you can always boil it, puree it, and mix it in your maybe rotis or rice, etc. So that there's an additional form of potassium-rich food going along with the rotis and rice, separate than the vegetable or something that you might be cooking.
Got it. So there's another question. Is hypertension at the end of the day also a metabolic disorder? And is there any link between hypertension and PCOD in women?
So hypertension definitely, I would say it is a metabolic disorder, yes. Why? Because it involves a lifestyle modification, right? Once a lifestyle is better, automatically the hypertension comes to place. If you are overweight, if if you're overweight, or if your lifestyle is not great, if your stress levels are too high, then that is also one reason why you can have hypertension. link between the PCOD and hypertension, I would say again, it is again in linked with your weight. So if you are high, if you're overweight, if you're hypertensive, then you definitely will have hormonal issues, because of which PCOD can, women can lead to PCOD.
Got it. Thank you. Thank you, Bhakti. So there's another question, right? So basically they're saying they keep sweating a lot due to high BP. What is to be done in this case?
So sweating is a natural phenomena. You know what your body is, the bodily reaction. What you can do is make sure if you're sweating too much, you're replenishing yourself with that much amount of water and electrolytes. So maybe you can have a lemon water with a little pinch of salt added to it so that your electrolyte balance is maintained very well. Make sure you eat. There's something known as eat your water as well. So you can have fruits and vegetables which are high on water, so that your body is replenished with the lost water due to sweating. Foods like cucumbers, bottle gourds, muskmelon. These are the foods which you can actually have, which are rich in water as well. So that's how you can replenish your lost water to sweat.
Got it. Thank you, Bhakti. So there's another question. So basically, so if you go into like a low BP, right? So what are some things that you can do to make it normal?
The first and foremost thing, and the best thing, what you can actually do is if you have a low BP issue, if you feel that your BP is going low, like I said, make sure you're hydrating yourself. So whenever you have any kind of liquid, make sure you have a little bit of salt added to it, or you have buttermilk with salt. Like now, because the weather is pretty hot, you can have sattu drink. You can sip on that sattu drink where you take a glass of buttermilk, add a tablespoon of sattu powder in it, put a pinch of salt, jeera, pudina, and coriander. Just blend it and drink it. That is going to make sure that your blood pressures are maintained also very well, because your salt intake in the entire day is good.
Got it. So there's another question. So they're saying that I am a disabled person and working in IT industry, and I can't walk more. So how can I manage hypertension?
If you cannot walk more, you can actually manage your hypertension by doing good amount of meditation also. So breathing exercises like pranayam, kapalbhati, anulom vilom, 5 minutes a day, each of them is actually going to calm down your nervous system, calm down your muscles, and also make sure that your stress hormones are managed and your blood pressure can come under control. Apart from that, what you can also do is, because you're sitting most of the time, I believe IT people are sitting most of the time, so you can just do a little bit of stretching exercises here and there, sitting in a place. So that way you're also activating your muscles.
Got it. Thank you, Bhakti. So I think we already covered this in the PPT, but there's a question. So the question is recording of BP in the lying position not recommended?
It is definitely not recommended, because when you're lying, generally your heart rates are a little higher, and also your breathing is little compromised when you're lying on your back. So that's why we always recommend to sit in an upright position and check your blood pressure.
Got it. So, so this question is, are there any specific foods that will help to reduce blood pressure and blood sugar levels if they become high suddenly?
Suddenly, if they become high suddenly, there is no magic pill to suddenly reduce your blood pressure or suddenly reduce your sugar. The only thing you can do is sit, relax, sip in water, and I think that is something which is going to work.
So there is this question on creatinine. So they're saying मेरा creatinine 0.353 है, ये ठीक है क्या, या फिर इसे ठीक कैसे करे, कितना होना चाहिए? She is 50 and she's a female.
0.53 creatinine level is in the normal range. So आपको वो normal range को ठीक करने के लिए कुछ भी करने की जरूरत नहीं है.
Okay, got it. Thank you, Bhakti. So there is another question. So like, you spoke about the low intensity, the high intensity. So why is it's not recommended that, you should not be doing a high intensity or a very high intensity workout when you have high blood pressure?
So when you have high blood pressure and you do high intensity workout, of course, the pumping of the heart is going to be higher. Already the pressure in your veins is high. So when the pumping of the heart increases, the pressure also increases. So it's always recommended to do moderate to low, where the heart pumping is regulated, monitored, and it is not putting the pressure on your arteries to hold that flow of, that push and the flow of blood.
Got it. So that's another question. So how often should we check our blood sugar levels and blood pressure levels? Like how often should it be, the frequency?
If you are a blood sugar and a blood pressure patient, it is recommended to check both of them on a daily basis. Generally, we recommend at least 2 readings for blood sugar levels in the entire day. One is, of course, your fasting, and the other is post your meal. And even your blood pressure to be checked on 2 different timings, one in the morning or one in the afternoon and evening, whatever is okay for you. So, and plus make a note of that. Making a note is very important. You check and you keep it here, it doesn't make a difference.
Got it. So, Bhakti, there's a question on fruits, right? So, what are the fruits that you can take if you have a higher, sugar level?
I think I always say you can have each and every fruit in moderation, except all the fruits that are high on starch, which is your banana, your mango, chiku, and sitapal. To some extent, even these fruits are okay if they are had in moderation once in 15 days. Rest, you can have any fruit in around 150 gram to 200 gram max portion size. But make sure you're having good fats also along with it, so that the trace minerals are absorbed in your body. Good fats in the form of seeds or almonds and walnuts.
Okay, so there is another question. So for sweet dish, can Khansari sugar be used for diabetic patients?
I think the user means khand is what I'm assuming Khansari sugar is
She
khand.
says it's a chemical-free and physically extracted sugar from liquid jaggery.
Unpolished one. But even if you're a diabetic, I would not even recommend khand or Khansari sugar to be used for that, because it is one and the same thing. It is giving you empty calories. It is giving you plain sugar. It is a simple sugar, though it is, chemical free. It is still simple sugars and is going to raise your blood sugar level. So not recommended.
Okay, got it. So there's one more question. So they wanted to ask if is it due to medicine of diabetes that weight get reduced, or is it due to stress or tension? I am nearing 60 and having diabetes from the last 10 years.
It can be because of stress also that you're reducing that weight, or it can be because of the medication. Until the time we don't see the medication, it is difficult to tell you that it's because of the medication or stress, because most of the times when you're stressed, you end up gaining a little weight because your metabolism gets disturbed due to the stress hormone, which is cortisol. So that reverses your fat metabolism, ultimately gaining fat. So reduced 8 to 9 kgs in the last year. It can be because of, diabetes. It majorly can be because of diabetes and medication. So I think also because of lifestyle. So you also have to keep a check on what you're eating, to speak to your healthcare provider, to check if you're eating the correct things or not. Because if you are diabetic since 10 years, there is a possibility that your sugars can come under control.
Got it. So there is another question. Is sugarcane juice safe to be consumed by people with diabetes?
Absolutely not, because it's again the same thing. It's simple sugar you're having in the form of water. Your body absorbs water faster. So the sugarcane juice is going to give you an immediate spike because it is simple sugar. Your body is going to absorb it immediately.
Right. So I think Bhakti, I think a lot of people also have this question about tender coconut, right? Because summers are coming up. So could you maybe just touch upon that as well?
Okay, so if you have blood pressure issues, tender coconut is definitely one of the best electrolyte that you can have. But if you have blood pressure along with diabetes, it is again a controversial question to have that or not. But recommended if you have diabetes and hypertension both together. Do not have it on a daily basis. You can have maybe once a week because tender coconut does have the tendency to increase your blood sugars also. In fact, if you want to have that, do add some, chia seeds into your tender coconut or in that way. So maybe have some seeds or nuts along with it whenever you have it.
Okay, so there is another question. So, are there any alternative options for sugars like sweeteners or naturally sugary foods?
Um, Sometimes you can definitely use fruits as your natural sweeteners. You can top up your fruits into your custard and have it. Or maybe if into your oatmeal or something, you can just chop up some fruits and add into that. So that is again an alternative or naturally sugary sweet fruits that you can add. Apart from that, even sweeteners are not, recommended because on the long run, they do, interfere with your hormones. And hormone is something which we actually are trying to rectify. So as far as possible, use that as the last resort. Wherever you can use fruit as a sweetener, use that.
Thank you, Bhakti. So there are a couple more questions, right? So Shanti ma'am is saying, I'm not able to reduce weight in spite of doctor prescribing 2 medicines per day. So that's her questions. Maybe you can, maybe touch upon a couple of things which will help in order to, lose weight.
Sure. So, Santiji, it's not just the medicine which is going to help you lose weight. It's, of course, your lifestyle. It is what you eat, how much you eat, when you eat, with what you eat, and what workout do you do. That is something which is going to, help you reduce weight. So, like I said, the 4 rules also are applicable for weight loss, where you have to eat good amount of fibers in the entire day. Make sure you're having a protein-rich diet if you do not have any kidney condition. Make sure you're drinking good water, I mean, hydrating yourself, and you're exercising very well. Unless and until you don't exercise, you don't use up the stored fat in the body, it will be difficult for you to lose weight.
Got it. So there's another question by Mr. Anup. So he's asking, what is the time in a normal day when a person will have maximum and minimum BP?
Thank you.
Sorry. Yeah. Okay, I'm so sorry, Bhakti. Yes. So the question is, what is the time? What is the time in a normal day when a person will have minimum or maximum BP? His second question is, if stevia is taken once a day, is it okay or no? Or can we take sugar or honey, anytime if the person is type 1, diabetic?
So answering the first question, generally the circadian rhythm that flows, in the night, gently between say, around 4 a.m. is or something when your blood pressure is gently at the lowest. Maximum is of course when you are doing intensive workouts. That is something when your blood pressure is maximum. So on the times when you are relaxing very well, that is when we can say that your blood pressure is going to be minimum. And stevia taken once a day is okay. See, again, stevia is natural sweetener. It is a sweetener. So as far as possible, if you avoid that, that is going to be great. But if you feel that it is something which is unavoidable, you can definitely go ahead and take maybe once a day. But I would recommend instead of taking any kind of powder or pills, you can go for natural stevia leaves, boil it into the water and use that water, maybe 1 or 2 drops into something which you want a little bit of sweetness in. And no honey, no sugar, no jaggery to be taken, all of the same.
Got it. Thank you, Bhakti. So there's another question, right? So I think a lot of people have a lot of questions on sugar, jaggery, sweeteners, and everything. So Shanti was asking, sugar patient, can they not take sugary items lifelong?
Absolutely not. Once in a while, if you take a little bit, that's fine. I mean, you cannot stop living a life. For me, once in a while means once in a month. So maybe a little bit in moderation, maybe in moderation, once in a month, if you end up taking half a motichur ka laddu is going to make no harm, but make sure you're compensating that with good amount of fibers in that meal or the meal followed by that.
So there's another question by Mr. Mukesh. So he's finding it very difficult to control food, eating habits basically. So he's asking, what can I do for that?
So first, follow meal sequencing. See, meal sequencing is something which works wonders for everybody who wants to maintain a healthy lifestyle, be it for diabetes, for high blood pressure, for weight loss, etc. Always make sure that you start your meals with fiber, which means you're giving prebiotic to your gut. Start your meals with good amount of vegetables, seeds, cooked salad, like I always say, cooked salads, or maybe in the form of raita, or maybe in the form of smoothies. Then proceed towards having a little bit of protein that you have in the meal, be it sprouts or non-veg, etc., paneer, and then proceed towards having the main meal. Because by the time you reach there, your 60 to 70% of the stomach is filled. You will automatically be able to control the portion size of the carbohydrate, of the non-needed substance, very well. And firstly, you have to keep a goal in mind. Mukesh, you have to understand that why you want to control this eating habit. Is that important for you or not? Keep that as a priority list. Only then you will be able to follow that eating habit and to control the eating habit.
Okay, got it. Thank you, Bhakti. So there are a couple more questions that I think we can take up. So one again which is by Mr. Anup. So he's asking what can be used in food for a person with diabetes as a replacement for ghee or oil, like peanuts, chia, coconut. And that's what his question is.
So you can use ghee, of course, but not too much. Ghee is not a zero completely. Everything in minimum is okay. You can use coconut oil for cooking. You can use groundnut oil for cooking. You can also use olive oil, but olive oil is majorly used just for tossing or to eat it raw. You can also use sesame oil to some extent for cooking, but make sure it is used only how much it is needed. You can also put grated coconut as we generally put it as a marination, or we generally put it as a masala. That is also fine.
Got it.
And
yeah, please continue.
Sorry. And seeds, like flax seeds or something, also can be put into your meal or into your sabzi or something as a replacement to bad fat in the diet.
Got it. Thank you, Bhakti. So there's another question, like what are the foods that will help us, which is fiber rich basically. So what foods can we take on a day-to-day basis?
Vegetables are the best things that you can take on a day-to-day basis. They are, they say that they are unlimited foods, but of course, there is a limit to that as well. So you can take make sure that your 50% of plate is filled with vegetables. They are high on fiber. Your pulses and legumes and sprouts are high on fiber. That is also something which you can take. You can also take seeds, roasted seeds like flax seeds, like pumpkin seeds, chia seeds. All of these also are high on fiber. And fruits, they are also high on fiber. In fact, if you're taking grains, if you take whole grains are also high on fiber. Millets are also high on fiber. But everything in moderation.
So actually, this is another question again, excuse me, related to stevia. Mr. Anup, so he's saying that if I don't take sugar or honey on any time, but take stevia once a day, is that okay?
Yes, I said the same thing. Wherever you can avoid, brilliant. If not, then stevia leaves are a better option than stevia powder or stevia pill. So it is okay. Wherever you can avoid it. But if you know that you're not able to avoid it at all, maybe have once a day, a little bit.
Okay, so another question about stevia is there. So this is about what is the quantity that is okay for a person with diabetes?
There is no quantity of any sweetener okay for diabetes, because sweetener is something which we actually don't recommend at all. But if you want to have it, if you want to have the stevia, just take 3 or 4 leaves, boil water, and maybe put a teaspoon of that in whatever you want, because stevia is naturally very sweet. So again, depending on how sweet you want that, preferably avoid.
Got it. So Bhakti, there's another question. So this person is saying that they have, tea like in the morning twice and coffee also like in the evening once. So they have a lot of like, these beverages, like caffeinated beverages. So how can I reduce my intake? Are there any alternatives that I can choose?
Definitely. So you can always opt for infused waters instead of having these caffeinated beverages. Infused water with cinnamon and infused water with lemon, ginger. That is something which you can choose. You can also, have a beverage which is actually made of just seeds. So you can add fennel seeds, you can add ajwain, you can add your jeera into water, boil it a little, strain and have that. This is actually called as a digestive tea, is what we in the nutrition term we say. This is something which you can always replace it with the caffeinated thing. You also have decaf beverages nowadays. You can go and have that. Another best option you can have is if you want the tea kind of a feeling. The best option you can always go and opt for infused flower teas. Like you have blue flower tea, you have hibiscus, you have chamomile. All of these is what you can have and replace it with your caffeinated beverages. Preferably don't have more than 2 cups of caffeinated or tannin beverages in a day.
Got it. So I think we'll just take like one last question before we end, right? So this question is basically, so they work in a night shift. So, sleeping is a challenge. So then how can I, get better sleep or, get the 7 to 8 hours of sleep?
So whatever time your shift ends, just go off to sleep immediately after that and just get a 7 hours sleep at a stretch after that shift timing. What in some situations we cannot avoid it because you cannot stop working. So if the timings are a challenge, definitely whenever you stop working, that's the time you can sleep. And before sleeping, make sure. So I'll tell you one pose what you can do for better sleep. If you feel that the sleep is a problem, what you can do is you can try a pose which is known as leg to wall pose. You can Google it, where you have to lie down on a bed, keep your hands open beside you, and make sure that you are elevating your leg at 90 degrees. Move ahead and stick your hips to your wall and make sure you're lying in that position for at least 5 minutes. This is going to calm your muscles and your central nervous system, and you will get good sleep.
Got it. Thank you so much, Bhakti. I think that was the last of the questions. I think we've answered all of them. Thank you so much for your time, and thank you so much for patiently answering all the questions. And thank you so much to all the audience as well for joining in and asking such great questions. So yeah, thank you so much everyone for joining in, and thank you so much, Bhakti. We'll also have a very similar session next Friday as well. So please do join in.
Thank you so much.
Thank you, Bhakti.